Hello, Namaskar. This is Dr. Shumon Mollik, Clinical Director and Chief of Radiation Oncology, Narayana Hospital, Howrah. So today I'll discuss about few aspects of radiation therapy and radiation oncology. So radiation is basically it's X-ray or gamma ray. When it is given on a cell or tissue, it breaks its water content and makes free radicals. These free radicals interacts with the DNA of the tumor cells or DNA of the bad cells, and it causes DNA damage, and it causes permanent damage of the DNA of the tumor cell, by which we see there is response in therapy, especially in cancer cells, and it causes sublethal damage in normal cell, which causes recovery of the normal cells after radiotherapy. So there are various types of radiotherapy. So one way is the thing we are using, like either gamma ray or X-ray or particle beam therapy. So these are the types of radiation, and there are few different techniques of radiotherapy, which like conformal radiotherapy, intensity modulated radiotherapy, image guided radiotherapy, radiosurgery. In radiosurgery, what happens? Very high dose of radiotherapy or radiation is given on a cell, on a tumor, and it causes ablation of the tumor. So it doesn't require any kind of surgery or any incision, any blood loss. But from outside, high dose of radiation can do effective therapy as like surgical ablation. It causes radiation induced ablation, which is known as radiosurgery. So apart from radiation from the outside, often we do radiation from inside the tumor, which is known as brachytherapy. So there are several forms of brachytherapy, like intracavitary brachytherapy, interstitial brachytherapy. Nowadays we do three-dimensional brachytherapy, which is MR guided brachytherapy. So entire the procedure and as well as the planning of brachytherapy is done under MR guidance. So all these things, all this improvement in radiotherapy is basically to reduce the side effects of radiation and to improve the outcome of radiotherapy. So nowadays, with the newer techniques of radiation, we can achieve higher tumor control in our patients with very less toxicity, radiation associated toxicity. So as I was mentioning about the radiation related side effects or toxicity, so sometimes it's unavoidable. Like when radiation is given, it doesn't cause any pain, any burning sensation, anything for radiotherapy. It's basically X-ray or gamma ray. It's like doing an X-ray. But if you continue radiotherapy for certain duration, so usually we see some form of side effects, especially when say we are treating any laryngeal tumor. So we know larynx or pharynx is important pathway, like while we take food, it goes through the pharynx. When we inspire or expire, usually the air goes through the larynx. So it causes laryngitis, pharyngitis. That radiation can cause inflammation of the local site. And for this inflammation, we give anti-inflammatory agent, painkillers, non-steroid and anti-inflammatory agents to reduce the pain symptoms. So these limited symptoms or signs can be controlled with ordinary medications. Sometimes we do require some higher pain relief substances, and whatever the side effects we see during radiotherapy, these are all temporary side effects. Whenever we stop radiotherapy after completion of entire schedule of the radiotherapy, usually we see the improvement in 1 or 2 weeks of radiotherapy. So patient can come back or can actually continue his or her normal life after completion of radiotherapy within 2 to 3 weeks. So these limited side effects can easily be controlled with some basic medications. So there is no worry about radiotherapy, because radiotherapy, whatever the side effect it causes side effects only to the local site. It doesn't cause side effect in far away. Like if I treating a breast tissue, so it will cause some darkening of the breast skin. It doesn't cause hair fall or pain in somewhere else. So basically radiation related side effect, it's a local side effect, not the systemic side effect. People often ask me about chemotherapy and radiotherapy. What is the difference between radiotherapy and chemotherapy? As I was mentioning about the side effects of radiotherapy, so radiation causes its effect and side effect at the local site. It doesn't have any action to other sites. On other hand, when we give chemotherapy, usually chemo is injected through the vein in the bloodstream. So it causes its effect to entire body. So whatever the effect and side effect chemotherapy causes, usually we see to entire body. Whatever the effect or side effect caused by the radiotherapy is caused only to the local site. This is the basic difference of chemotherapy and radiotherapy. So now the thing is whether chemo and radiotherapy both are required or not. That depends on the stage of the disease itself. So in some disease only chemotherapy is useful. In some disease only radiotherapy is useful. And in some disease we have to combine both chemotherapy and radiotherapy. So whether to give chemotherapy or radiotherapy, that depends on the type of the disease, stage of the disease, and definitely the patient's condition. So that these three are the important indicator for selecting chemotherapy and radiotherapy. Nowadays radiotherapy is quite advanced kind of therapy, and all kind of advanced radiotherapy techniques and options are available in our hospital. So which includes intensity modulated radiotherapy, image guided radiotherapy, stereotactic radiosurgery. So with the current radiotherapy practices and machines, that what we have an integrated CT scanner in our radiotherapy machine. So when actually we are delivering the radiotherapy treatment, we can see the patient position, we can see the tumor position, and we can see whether radiation is hitting the target or not. And based on that, we modify the patient's position in 6-dimensional way. What is 6-dimensional way? So that is the 3 types of translational movement and 3 types of rotational movements can be corrected at the time of radiotherapy. So this is the most advanced form of radiotherapy that we have, that is image guided 6D radiotherapy. As well as we can actually chase the tumor. If sometimes we see like lung tumor, it can moves with respiration. So this kind of tumor can be chased and can be treated by respiratory gated radiotherapy. And by this kind of modern radiotherapy techniques, actually we can reduce the radiation related side effects significantly. Patient can tolerate the radiotherapy, and we can increase the dose of radiotherapy, by which we are getting better outcome in our patients by this newer kinds of radiotherapy. One of the important factor that radiotherapy has, that is the organ function preservation. Like suppose there is a tumor in the vocal cord or larynx. The previous days the treatment was laryngectomy. So one of the important aim for radiotherapy treatment is the organ function. So we can preserve the voice, we can preserve the organ. Sometimes we may not require any kind of surgery or organ loss, because those tumors can be cured only by radiotherapy or sometimes by addition of chemo along with radiotherapy. Like organ confined bladder tumor, that can be cured with radiotherapy alone along with chemotherapy, by which we can actually preserve the function of bladder. We can treat the prostate gland without doing the surgery. by which we can cure the prostate gland. We can cure the GI tract tumor without doing the surgery. So, modern day radiotherapy actually allowing us to preserve the organ function, to preserve the normal activity or physiological activity of a patient. So, we can avoid a lot of surgeries, lot of other debilitating surgeries with the modern radiotherapy techniques.